with Noah, and who's the other one? That Melanie and Amanda. You three, I think we're just going to exclude from discussion completely today, because you guys are going to ask the question that we're going to cover in the next slide anyways, every single time. Or maybe I just need to get faster.
Ooh.
Faster.
I like the latter. Yeah. What you just said?
No.
You just need to get faster.
I need to get faster? Yes, okay. Huh, is everybody ready?
What did you do?
I didn't put any on.
Okay.
But I was
Because I
gonna,
was uncomfortable yesterday.
that stuff, that lotion stuff?
Whatever you were doing.
Yes, that lotion stuff that got super awkward. Like, I was gonna ask for lotion again today, but I changed my mind immediately.
Good idea.
I'm just like, nope, bad idea. Bad idea. Okay. Alright, so you must arrive at 59-year-old male on the ground. Yes, no, maybe. I don't know, not working. What that says. Okay. What's your thoughts?
Seizures.
Oh, good, seizures, huh? Because we're going over
Well,
seizures today?
What was the shaking of his left arm and leg?
I don't
Was
know.
he doing the Dougie, or was he like seizing shaking?
Positive.
He's doing this
positive,
kind of thing.
positive.
He's doing this kind of thing. This kind of thing.
What we got?
Right?
What we got?
Alright, what's your thoughts?
Is the patient breathing?
Yeah, he's breathing. Good question. But why don't you follow up with just, instead of a generalized, is he breathing?
Respiration, valve.
He's breathing at, let's say 18. And normal.
Well, he's breathing as pulse, obviously. Okay, does he, what's the word?
Respond?
Yeah.
Are you
Is he respond to
left-handed?
pain?
Are you left-handed?
No.
Oh, you just throw left-handed, getting ready for the softball game?
No, because I
You're like,
have.
hey, maybe I'll be better left-handed than I am right-handed?
So is he responding to like your questions?
Yeah. Yeah. Do you want to ask me a question? Nope, it's gone.
Uh-oh.
Oh, that's 3 answers you have to give us.
What's going on? Where are we going?
What's up, dog? Right?
Why am I here?
Why are you here?
Are you having any pain
Yeah.
anywhere?
No, no pain.
Okay, do you feel lightheaded? Like where are you on
Yeah.
the ground?
Can he talk?
Positive loss of consciousness, huh?
Yeah,
Okay.
yeah.
Yeah, I'm feeling a little lightheaded.
Alright, let's go CBG pupils.
Oh, that's what you're going for, CBG
Yeah.
and pupils. Okay, well, you're looking at his pupils. Pupils look okay.
Pupils are okay, follow up CBG.
CBG, it takes a little time to get CBG, so now what are you gonna do? You're just
Full
gonna hang
neuro.
out and wait?
No.
Oh, neuro?
Yeah.
You're doing neuro exam?
Yeah, I am.
Oh, what do you wanna do first?
I want to do eyebrows first, then close the eyes, then open the eyes, keep them tight. Do you want me to just talk you through it?
I don't know, I want the ball back for starters.
Okay.
Continue.
Okay, then I'll do.
If you miss one, though, you gotta do 20 push-ups right here, right now.
Okay. So once he closes his
I
eyes,
like the confidence.
then I'm asking
Do it
him
tomorrow.
close them tight, close them really tight, making sure they're both equal. Open his eyes, keep his eyes closed. I'm going to touch one side of his face. Note if he can tell me which side, other side. Note if
Left
he can
side,
tell
right side.
right side or left side. Have him open his eyes.
Faster.
Do
Hold on. Let's just perform your neuro exam right here.
Okay.
Go.
All right, sir. Can you raise your eyebrows as high as you can? Okay, good. Can you close your eyes? Tight, 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 tight. Okay. I'm not seeing any droop or. All right. Can you tell which side of the face I'm touching?
Right.
Okay. Can you open your eyes? Okay. Can you pull up your finger? Right finger. Touch your nose. Is that what he's doing?
You're just gonna let him fall in the middle of a neuro. You're just like, and peace.
I don't know if you were pushing him or touching.
I didn't push him. I didn't push him.
Is he seizing?
No, he's not seizing. He's just laying there.
Okay, so can you talk to me? I can't remember. He just fell over.
Yeah, dude, he just fell over.
Okay,
You
can
started making him try to do stuff, and now he just kind of fell over and maybe had a positive loss of consciousness.
Okay, can I sit him up? Or did I see him fall with like?
I don't know. Did you watch him
fall.
go?
Yeah.
Okay, so you probably saw him.
Okay. So I'd actually look, sir, did you feel any pain when you fell? Okay, did you hit your head?
I don't think so.
Okay,
Well, you probably did hit your head because Lon
Probably
just
watched
let you
him.
fall and be like,
Probably
"I'm not
watched
gonna
him hit
brace
his
you,
head."
I'm not gonna do anything."
Catch me.
Okay, well, let's get you sit back up so I can complete the neuro then.
Oh, that's what we're worried about right now. Let's get that neuro exam completed.
Is he able to walk or no?
I don't know, dude.
Are you able to stand up?
Okay, I think so.
All right, can you help me on this side so we can at least sit him?
Oh, me?
Yeah.
Oh, you
my
want me to
partner.
help? Huh. I mean, I'm pretty fatigued after this morning.
Are you feeling
I got
lightheaded?
anything
Can I
left. Oh.
pick you up like that?
No.
You feel any different? No, I'm not doing that again.
No.
Can I ask a question?
Not yet.
Um,
Soon, Annalise, soon.
So what is my CBG? I'm assuming this is not.
Oh, you got CBG now?
Yeah.
Oh, right. So it's 88.
88. Okay. Okay.
Dude, how long are you gonna take to do this neuro exam? I mean, do we have the whole class to do it?
Nope, we don't. Okay. Can I have someone, like a partner, help me with the other side?
This is not working the way I wanted to.
Okay, I just want you to hold it and make sure Kris doesn't push him over.
So the question I have is, why are you sweating right now? Josh, need you give me any advice on the whole sweat thing? Stan? I want you to know Stan too.
Okay. So CBG pupils to referral. Okay, and I saw like momentary just loss on his left side.
Momentary, I don't know, did you ever make it to his left side?
Well, I'm working on that. Okay.
Working our way there.
Yes.
Oh.
Okay, sir, can you hear me?
Yep. Ah.
Yes.
Yes.
Okay. Do you remember falling?
Yes.
You. Okay. Sir, can you hear me?
Yep.
Okay. I want you to like follow my commands the best you can, okay?
Okay.
All right?
All right.
Okay, can you pick up
Okay.
your right hand? Left hand. Finger. With your left hand.
No.
You can't do that. Okay.
I can't do that.
Okay. Well, we'll continue on. Can you push up on my right arm with your left leg? Can you move it at all?
What part of the neuro exam is that?
Well, you can't
Where
do
does that come from?
Well, he's sitting down, then I want to get back up. No.
20.
Just modify
Yes,
them.
I can.
Modified, okay, we're going modified, okay. We're just gonna make up our own stuff as we go. Cool, I like
That's
it.
20%.
Can you push up on my left arm with your right leg? Okay. Looks like I have deficits on patient's left side, arm, leg. Want to get him transported.
Code 3 to the hospital. Good job, here we go. Mons. Going once, going twice. Hey Mons,
Yep.
did you do his like uvular check or smile or any of those kinds of tests at all?
No.
Shoulder shrug?
I could do that in the back.
Oh right, so you did half the assessment and then kind of quit halfway through. You did like a 2-step Cincinnati assessment and then kind of quit, right?
Halfway through, and then in the back, I'd finish it.
Yeah. Okay, cool. Go ahead, Annalise.
Are any of those deficits normal for him?
Normal market? Normal? No, they're not.
No, they're not.
Alcohol in his breath?
Oh, absolutely.
What was the question?
Are they normal and is there alcohol on the breath?
Do you take any blood thinners?
Yes.
What do you take?
I take
What was the
Pradaxa.
answer to alcohol in the breath?
Yes.
What do you take that for?
I take it for an irregular heartbeat.
Is that
Good.
I don't know what it is. The doctor just gives it to me, and so I take it. And I'm not really constant with it. Josh, dude.
do you have any history of stroke or TIAs or anything?
No.
Do you have a history of blood clots like DVTs?
I don't know.
Teenage thrombosis?
I don't know what DVTs are. I know. I want to.
Because you two are a pair.
The aggressive paramedic. It is obviously not Brooke.
Have you taken any other drugs other than drinking alcohol?
Like what? I don't know what drugs are.
I'm glad that everyone's questions are directed at me now. Yes.
Okay.
Do you know anything?
What drugs?
What drugs do you take?
All of them.
He takes meth on occasion.
Just meth on occasion.
Did you take meth today, this morning, last night? When's the last time you done meth?
2 days ago.
2 days
Haven't
ago.
slept since.
I haven't slept since.
I'll do that, yeah.
So, pretty early in the morning, you, how much you had to drink already?
Never stopped.
I'm judging.
I never stopped.
Well, that's okay, 5 o'clock someplace.
I love how you guys like ask him a question and instantly it's just be like, it used to be like people would like hang on to the ball as long as possible and be like,
Or
I
just
got a lot
really
of questions to
moms.
ask.
Hey, so how much have you had to drink this morning?
Just keep going.
Just keep going? So how much would you think you drank today?
At least four locos. When I take the ball back, that means you can't have it anymore. Okay?
Can we get some vitals and EKG? And
Thank
have
you.
a history of hypertension?
Oh, hypertension.
You said you had a regular heartbeat.
Which one do you want first, Maddie?
Hi.
You're so demanding. So demanding. We gotta get some priorities here.
Let's have my partner put on a 12 lead, and I'll start on heart rate and blood pressure.
12 lead shows AFib at 88,
Okay.
irregularly irregular. What else did you want?
Heart rate, blood pressure.
Heart rate is 88. Blood pressure is, it's timed out 3 times.
Okay, what about manual?
Oh, you're gonna get manual, that's gonna take a little while. You got bad partners.
Okay, well while they're doing that, I can ask questions. Does he
Okay.
have any signs of hypertension?
Currently, no.
Okay.
There's no signs of hypertension. I don't know what a sign of hypertension would be.
Does he have a history of hypertension? Is what I'm asking.
Yes.
Thank you.
I love it when it's like, here it comes, here it comes, here it goes, boom! Nope, not, I'm not gonna get you. So just so you guys know, the ball is going to come to you guys at some point. You have to be ready with questions. Because right now, the aggressive paramedic, I'm not saying there are aggressive paramedics out there, but they're getting ready to take the call away from you because you aren't asking any questions. Go, Nate!
That happened
You
yesterday.
already lost it. You
That
lost
happened
it.
yesterday.
You lost your question because you weren't fast enough. Skin is pale, cool, and warm. Diaphoretic. Pale, cool, and diaphoretic.
Oh, that scared me. Have you fallen recently?
We just saw him fall right
I
there.
mean, okay, besides that.
Positive, loss of confidence.
That doesn't mean anything. You could have been in a chair.
No falls. No falls at all. Oh, look at this, Justin. Who's this guy? I got a hand up and everything. Justin's engaged.
Do you have any recent traumas?
No.
What is the last thing you remember?
Oh, I remember walking to the bus stop this morning. And then they got the people that won't even make eye contact with you. They're like, oh, please no, please no, not to me, not to me. And here comes that aggressive paramedic, and the aggressive paramedic starts taking the call away from you.
How long ago did this start? How long has it been going on?
What? I don't even know what you're asking. What about?
Your arm seems to be
Whoa!
shaking.
Look at that, that's a full on like Heisman
How long has it been going on?
What?
Your arm seems to be shaking. How long has it been
It's
happening?
not really shaking anymore, it just doesn't seem to be working right.
How long since it was last working right?
Pretty much when I passed out heading to the bus, and then kind of woke up, and that's how it.
How long ago was that?
That was about an hour ago.
Great.
Does anybody have any other questions they'd like to ask?
Temp.
Yes.
The pulses
Oh, you're back. You're back.
are the pulses equal on both
Yes.
his arms?
Has this ever happened to you
Oh,
before?
Josh.
Do you have any pain?
No.
Can I ask one of his machine friends when the last time they saw him completely normal?
Oh, I know him. Yeah, he's a drunk. Yep.
When was the last time you saw him completely normal?
Oh, he's never normal. He's always drunk.
Are you drunk? When was the last time
I'm
you
drunk too.
saw him when he wasn't like this all
I knew I was coming to class, and it's the only way I can deal with you guys. Halfway intoxicated every
that.
single day.
Has he ever had this before?
Never.
So when was the last time he was hospitalized?
I didn't go to the hospital.
You've never been transported?
I didn't say that, but I've never been hospitalized.
When was the last time you were transported?
Oh, I go usually once a week. Yeah, let me have
And
the
what do you
ball.
go for? What do you go for?
I just wanna get warm and have food.
Is that what's happening now?
I don't know, you tell me.
Well, we'd be happy to take
Give me
you.
Oh,
Where's James? James, I need the chokehold.
Blood choker's there.
oh, I got it.
Oh, you got something?
Sure. If I take his hand and put it above his head, does he let it fall into his face?
Oh, that's definitely part of our neuro exam, isn't it?
What?
We already decided that his left side is not working.
Damn it, I had a question.
But is it
Is
true
it-
enough?
You can give
Or
me 5
is he
seconds.
just
4,
faking it?
3,
Got it.
2,
Wait. fuck,
1, 0. God dang it, Michaela.
I had something, I swear.
on their face?
Yeah, because if somebody's faking a stroke, they're not gonna let that hand.
Yeah, but then you're
Oh,
just
you want
hitting
that blood
them in the
pressure?
face
Wait
with
a
their hand.
Did you see what just happened?
Blood pressure.
Did you see what just happened? Ah, Maddie, that is why I love you. You get that only. Maddie just followed up.
I
She-
asked it.
I know, but I'm saying, I didn't hear you. You didn't say, hey, throw me the ball, I have a follow-up question. But she followed up on something that I never gave the answer to initially, right? Which you guys commonly don't do in scenarios. You're like, I want this, I want this, I want this, I want this. And it's like, I will specifically
Leave out.
exclude some information because I know it's gonna give it away. And I'm not gonna give it to you unless you like come back and ask for it again, right? So my blood pressure is 190 over 120. Oh. Does anybody in here want to finish the neuro exam that Mons didn't finish, by the way?
I would do it in the back.
Oh, you guys want to finish it? Okay, good, good. I'm glad somebody wants to finish it. So what are we thinking?
Stroke.
Hemorrhagic.
So,
Frequent flyer? Holy moly. Anybody else want to go frequent flyer?
With that blood pressure?
You can't
There's
fake.
enough risk factors here that you're telling yourself absolutely not, right?
You can't fake a blood pressure.
Can't fake a blood pressure, right? Well, you can.
Yeah, try
Well, you can try
You
to.
flex enough, you know, right? That's why I said timed out. Maybe I was just flexing a little bunch, that kind of thing, right? No, so legitimate. So that's why we do manual blood pressures. That's why we do confirmations, right? So you put the Zoll monitor on, boom, it pumps up. Oh, 215 over 150. We're like, oh, that's the blood pressure. Or what do we do?
Recheck.
Recheck.
Recheck it manually, right? We're just like, oh, okay. And then we're like, and you know what the funny thing is? When somebody comes back with that blood pressure, they're like, nope, that's accurate. That's where we're at. And what does that do to everybody sitting there?
Oh.
We're like, oh, okay. That changes your whole thought process, right? When we see it on the monitor, we're just like, okay, whatever, right? It's like, we'll recheck it. And then it's always surprised when it comes back at the same thing. You're just like, oh, okay.
Didn't see that, how the equipment
This
works.
is legitimate. This is legit. Hypertension. So are we in a hypertensive crisis right now?
Mm-hmm.
Sort of.
Andrew, ooh, I like to know. What do you got?
I forget what the BP like cutoff would be, but I would say something over 200 would be a hypertensive crisis. But he didn't say that he was having other symptoms like double vision or blurry vision or anything like that.
Or what other
Loss of consciousness
pain in the back of the head.
and weakness in one in his arm.
Would hypertension cause a loss of consciousness?
Why would it?
What causes losses of consciousness in regards to if what we're thinking here, this person's having a stroke? When somebody has a stroke, what's happening?
Reduce
Decreased blood flow to the brain, right?
Mhm.
So that's what we're looking at here, right? Is hypertension gonna cause a decreased blood flow in the brain?
No.
Not usually, right? So that the hypertension really isn't going to cause this type of a thing, right? So the hypertension is a risk factor. The Coumadin is a risk factor. The AFib is a risk factor. So there's all these risk factors that are building up. Alcoholism, drug use, right? So you have all these things that are just like red flag, red flag, red flag, and then left side's not working. I'm gonna do a third of my stroke assessment and figure out, hey, I got this thing going on, right? You're a good sport, Mons, by the way.
I
So
would finish it.
I know you want to finish it, right? Yes, Melanie.
So is loss of consciousness?
I would throw you the ball, but I know you would just dodge it when it came at you.
The loss of consciousness is not something that would present with a hemorrhagic stroke, but with a
Ischemic stroke.
ischemic stroke.
So hemorrhagic strokes, what type of? So is a hemorrhagic stroke a bleed?
Yeah.
Do we have head bleeds that have loss of consciousness associated with lucid periods.
Yes.
When he wakes up and then he's fine for a little while.
Was he complaining of like
Why?
a headache at all?
Oh, we're gonna ask about a headache. Yes, I have a severe headache.
You said no pain
Wait,
though.
there's no, you said there's no pain.
Oh, did I?
I asked that.
I was thinking because you guys are thinking
That's
trauma.
not.
My bad. Okay.
So no headache?
No headache. I'll take it back. No, I'll take it back. Way to call me on it. You guys are really good about that, especially
I asked you if you
especially
had
you two back there sitting together.
I didn't know.
I
I'm
didn't
sorry,
know.
I didn't know. I wasn't privy to all the information. What was going on with
Doesn't
you?
that increase the risk of not getting something?
You said you wanted to be more
Or partial,
Shoving it into a smaller
So
artery.
it's one of your risk factors associated with it, right? But more than likely, it's not going to be the cause of this loss of consciousness, right?
Unless actually not something.
Unless you have a head bleed that is actually actively bleeding and you have this lucid interval now. And then how bad of a stroke are we in right now? If we're having our lucid interval right now, how bad is this?
We're behind the.
We're behind.
Yeah.
Why can't?
No, not necessarily.
We'd have it for a
Because of increased pressure.
Can we go to the hospital now?
No, so the question was, so the question that Brooke
I
had
was like, let's go.
was, will you have a headache with every kind of stroke? The answer is no. Ischemia strokes, you do not end up having that worst headache ever in your life. The hemorrhagic stroke, you burst a blood vessel, the pain is severe, increased pressure, ICP, you're gonna end up slowly having that diminished LOC with that potential for that lucid period for it. So, sick or not sick? But we have like this homeless man at the mission that like we think is a frequent flyer.
And he's
He's
drunk.
drunk and
He's just
intoxicated in
drunk.
the midst of being on drugs. We already called the BLS unit because that's what we do. Yeah? No?
I said let's take him already.
But Mons was smart enough that he did a partial stroke assessment.
And then I'd finish it in the back, and then let's go.
But you're just a firefighter, like we're just saying that you showed up as a firefighter this time. You don't have an ambulance this time.
Oh, we switch up the
Yeah,
song.
I'm switching up your ability here, right?
And like, boom, engine.
Yep. So it's that kind of thing where it's like your thought process, you can't get pigeonholed into the whole idea of, hey, frequent flyer, this is what we got. Okay, yeah, same old, same old. You do your full assessment every time on every patient to make sure that you are able to paint the right picture.
In this case where you say you're behind the 8 ball, at what point do you say, yep, I know what this is, I don't need to do any more because it's a serious condition and I just need to move?
Right. So, in this
That's my-
patient,
yeah.
so is this a CSTAT positive patient? Did we ask any CSTAT?
We asked about the
No,
pupils.
I didn't ask
Well,
them.
We
We
didn't
didn't
get
have,
like
it was
conjugate
not,
gaze.
it was not no conjugate gaze, no slurred speech, that's already 2.5 points, so you cannot be CSTAT positive.
All right, cool. So,
What if you-
as you are making your assessment and a neurological assessment, that is the stuff that you need to verbalize out loud so that your crew members and everybody else is aware that you are going through, because that's what they need to know right away. It's like, hey, yeah, okay, this is gonna be a stroke alert, is this a CSTAT positive, yes or no, right? So those are just simple things, simple check-offs to go through to be able to figure that out, okay?
But you'd still qualify for a stroke alert,
Absolutely a stroke alert, absolutely.
just not on the CSTAT.
Correct.
That was my question.
They
If you
might-
don't know when it started, we just call it stroke alert.
They said it started an hour ago,
So yeah, we had an onset of an hour.
so less than
So,
6.
so you have, do we have a time limit on strokes?
6 or wake up.
Okay, so you have your 6 hours, within
But
6
in
hours,
a case where they don't know, what do you
you don't do a stroke alert on
do?
it. It's enough, then you call and say, hey, we got an unknown time, and they're gonna say, well, if we don't have a time, then we're not gonna do it, right? So,
And you call them for hemorrhagic as well though?
yeah, a stroke's a stroke, right? Stroke is a stroke. It's not our job to
Diagnose.
tell them how to treat the stroke once they get there, right? Because they're gonna go and do a head CT and figure out exactly how bad, what it is. All right, 74-year-old male with sudden onset left side weakness. She was at the church, noted left facial droop, injury hypertension, AFib. Oh. Mons, you want to try to do another neuro exam? No, you're good.
I said yes, I was saying
wanna
I
know.
would do it.
When was the time that you saw the patient, that you first noticed the facial droop?
I was sitting next to her at church, and it happened about 30 minutes into it.
I would love to do another one.
Do you have any history, Stroke?
I have had 4 TIAs and a stroke in my history.
Stroke assessment.
You want to do a stroke assessment? Okay, Dustin.
Before you get the transfer, and then,
High blood pressure.
stroke assessment.
No history of
What
Bell's
am I
palsy,
supposed to be?
anything like that?
This.
No history of Bell's palsy.
Hi, my name's Chandler, what's your name?
Hey, Chandler.
I don't know.
My name is Christina.
Christina, can you tell me what's going on?
No,
No?
I don't
Can you tell
know.
me where you are?
Yeah, I'm at church. I don't know why you're here.
Can you tell me what time it is?
Church time.
Church time?
Yeah.
Alright.
Same time I go to church every week.
What days do you go to church?
I go Sunday morning, Sunday evening, Wednesday evening. Saturday, we usually do the potluck. And Mondays, every once in a while, we have Bible study.
So what is that?
Did you do your hair later this morning?
Any what? Heroin? Yes.
Hail Mary.
Hail Marys, I did a lot of them. Every
Any
time I
family members-
lifted my weights this morning.
Any family members or friends that you can ask it, like, when the last time if this is normal for her?
Oh, thank you.
I thought you said
What's
he noticed
normal?
facial drop half an hour ago.
Yeah, the person sitting next to her.
No, he said half
Yeah,
hour
my husband.
into church service. He didn't say how long ago it was. It started just a half
Half an hour ago.
So this isn't.
Sorry, call me out on my specific grammar.
Sudden onset. So
It's
that
not in
means-
quotation marks or anything, but
So this isn't usual for her or anything?
she kind of, I mean, she had some stuff left over.
Like
from
what?
her last
Left
stroke.
over from what?
From her last stroke.
Well, like what?
Shh. You're the patient.
Obviously-
You can't ask questions.
Oh.
He can't even complete his neuro exam.
What do you mean? You like started asking?
When
Okay,
was
all right,
that?
close your eyes.
Sorry, when was that?
All right, can you give me a
Stroke?
big smile?
Fine.
That's a no. All right, can you raise your eyebrows for me as big as you can?
How much? Both?
I don't do your thing.
Okay. All right, you want to close your eyes for me? All right, got you right here, okay? You want to close your eyes for me? All right, and can you tell which side of the face I'm touching?
The right side.
Okay, and what side of the face am I
Left
touching?
side.
The left side, okay. All right, can you open your eyes for me? All right, can you follow my finger? Nope, just with your eyes. Okay, it's got something going on there. All right, so I want you to push up.
Hold on. Let's back up a little bit. You got something going on
So
there.
he's got nystagmus.
Okay. So you got something going on. All right. Is that a positive stroke finding?
Something.
It's not necessarily.
Okay. I like where we're going.
All right, can you lift up with your shoulders? Okay. I want you to smile again for me. Give me a big smile. And show your teeth. Okay, so. All right. So now I want you to touch my finger, okay, with your right hand. Okay. And go back, pull your arm all the way back in, and then touch it again. Okay. And all the way back in, and touch it again. Okay. All right, other side. All right, all the way in, and touch it. Oh, hello. All right, all the way in, and try and touch it. Hello. All right, good effort there. All right, can you lift up? Can you kind of press your legs up on your toes? Okay. All right, can you lift your toes up for me? Okay. And can you touch so just like me, can you go like that? But so heel of your foot to your knee. Yeah, and then down the, thanks, Maddie.
Like that?
I'm his partner. Needs to help.
All right, and can you do it on the other side?
Oh, like this?
Yep, perfect, okay. So he's got pretty full-sided left side weakness.
Oh, does anybody? Oh, do you guys want to finish a neuro exam? You want to
Yes.
finish the neuro exam?
Yeah,
No,
he's
no,
done
it
yet?
didn't
Not done?
finish.
So for you do a uvula check, you go ah. We also lift your both arms up, close your eyes. Close your eyes for 10 seconds, yeah.
I mean, I've been in church all morning, and I mean, this is how people. That's one of the things they notice. So it's just like,
What else you want to do?
Dustin,
Repeat
you
after
got
me.
your tongue?
Oh.
Hey, is it supposed to go towards or away? I can't remember.
Oh, jeez.
Supposed to go.
Oh, you got something?
Supposed
just go.
Oh, Cody,
Weak on one side.
don't let, you better hurry up. When we make it there,
Because the muscles on the right side.
vitals on the 12 lead, which one do you want first? Because
your
if
left
it's
side
anything like what you
deficit,
guys
you're
do
gonna
12 leads, it'll take you guys 2 hours.
Not that long.
Okay, 12 lead is AFib at 90. Vitals are 180 over 90. And stats are 98%.
90.
You said 90, dude.
AFib 90.
AFib 90. Oh, Michaela's engaged.
Yes.
Michaela's
Did we ever establish what his, what her
her.
deficits are compared to the new ones? Like,
Yeah.
did we ever compare that?
You did not really
We do
get
that?
specifications
Okay.
on it.
Can the family members tell us what's new?
Yeah, they could. You want to know it?
Yes.
Okay, so normally she's able to like do some stuff, has a little bit of dexterity issues, a little bit of sensation problems, but is normally able to move the arm around and do kind of stuff. Just not a lot of strength, not a lot of movement and stuff with that arm and leg. Walks with a limp, kind of a drop foot kind of a thing. Been in PT a whole bunch trying to fix it.
With the left side?
Mm-hmm.
Okay.
So with that,
Reconfirm
everybody goes
facial
silent.
trim.
They're like, oh shit.
So was it
Reconfirm
more
facial
than
droop.
that
Yeah,
this
so,
time?
wait.
like, obviously they
Yes.
called for a reason, so something was worse. So I'm gonna ask, what specifically were you concerned about when you called?
I didn't hear a facial droop.
Yeah, I didn't hear facial droop.
So
Oh.
she has a that's not normal.
The facial
face
droop
thing,
worse?
The face thing is not normal,
Okay.
and normally she's able to move. I mean, she can stand in church like this and not have any issues like this. And that's I couldn't figure out what she was doing when she was doing the one
She's only
arm.
halfway praising God.
Yes. So. Okay. Yeah.
Is she on any blood thinners?
It's on,
That's a
Do we
hypertensive.
know what that is?
It's for hypertensive
Oh,
med.
good job.
And then,
Did you guys because you guys looked it up?
She didn't.
I did.
What is
and
it?
then also skin signs?
Just pink, warm, and dry.
How are her pupils?
How are her pupils, Noah?
she had nystagmus, but the pupils look good.
Okay.
So no conjugate.
And is she slurring her speech?
Yes. Cool. What do you guys think?
Stroke alert, no
C-stat,
C-stat.
Everybody agree with the stroke alert?
Yeah.
Anything treatment-wise, what are you gonna do?
Because
Or IV,
she was,
proximal wrist.
knew where she was at. She wasn't
Like
confused.
proximal wrist, okay, great,
Confused.
yeah.
Because they're confused. Where she apologized. She slurred speech though.
So it's arm drift, but you have to have all that or conscious.
So what is the importance of remembering your vital signs and remembering your stuff? Because A, Kris will not let you write it down because you have to relay that information, right? So what you should remember is, was it high, was it low, was it in the middle, right? And so, did we remember that it seemed a little high?
180.
So if you said, hey, the blood pressure was 190 over 100 or 180 over 90, is there a difference there in anything that you're gonna do?
No.
Is there a red flag still associated with
Yeah.
that hypertension? Right, so knowing the exact number is not that important, okay? But having the idea without writing it down and remembering, oh, Chad, from way left field. Remembering that information is what's important. Chad, here you go, see if I can get it.
That is
Oh.
high, or that is.
Want to monitor his bowel response and make sure he's not gonna choke on his own, her own secretions.
Oh, geez.
Airway protection. Look at you.
Right now, are we concerned with anything that we have going on based on the presentation of any sort of airway compromise?
Not yet.
No. Is it
Not
something that we
yet.
should pay attention to, though?
Yes.
Yes.
Can the stroke get worse?
Yes.
Let's have all our stuff out. ready
That's
to-
what?
Let's have all of our stuff out ready to go.
You want to be prepared at all
Well,
times, right?
shouldn't we
All the
have
time.
been moving before we finished our stroke alert, our stroke exam, our neuro
Let's put the
exam?
intubation kit
So-
on their
so,
lap and be like, this
As soon
goes
as you
downhill,
move,
easy
right?
as-
Are you probably going to take the husband with you?
No.
Probably not, right? So as soon as you start just being like, oh, we gotta go, boom, 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 what do you then lose?
We've lost finding out our
You
baseline.
lose the pre-symptom comparison, right? So you really gotta be careful about that load and go
Yeah.
stuff because you lose if it's a critical patient, you lose riders, right? You don't have all your hands now, plus you lose a lot of information there on scene, right? So you wanna get that good picture before the load and go. The load and go drives me crazy at times because people are just like, oh, I see one stroke sign, boom, we're going, right? It's like, dude, come on, like don't just get in that diesel therapy fix for everything, right?
Take an extra 2 minutes
Exactly.
Do your due diligence.
For some people, 2 minutes. For others, it may take 5 or 6 minutes based on your guys' speed at which you guys work, right? But 5 or 6 minutes is still okay. I'm not saying that that's a bad thing. Like, I'm just saying.
Get the picture.
Yeah, it's like get the picture before you just go, right? Which I just got on my probate who took his test because I told you he had this pale guy that like he was just like, oh, this guy's sick, boom, on the gurney, and we're in the back of the ambulance. Let's go to the hospital. It's like, dude, come on, man, let's do some stuff. Fix this person first, right?
Did he pass?
He did pass, but I would not have passed him, and I told him right in front of the training staff.
Wow.
So, no, this is how it went, right? So we have this, so like if you lose your job with Eugene Springfield Fire, it's because you're a bad paramedic, right? That's what we lose people for. We don't lose them for fire skills. Usually we don't. I mean, every once in a while we'll have a Groundhog's Day person, where you'll teach them something, they'll walk up to the door 5 minutes later that you just taught them, and they look at it like they've never seen the door, right? So every once in a while you have Groundhog's Day, like one out of like 10 classes that'll happen. But we fire 2 to 3 people every single academy. You have the job, dream job, perfect, boom. You suck at being a paramedic, that's what we fire you for, right? So our training person is awesome. She's been there for like 100 years. She's not that old, but she's like got 2 years left, right? So she was an ER nurse at University District when I went through my paramedic 20 years ago. It was just like, and I remember her specifically because she was the awesomest nurse, willing to teach everything and allowed me to do whatever I wanted to do with her supervision, right? She's like, hey, let's do this. And I told her that when I started the academy. I was like, hey, I know you don't remember me, but you made a lasting impression on the way I approach like other students and stuff. And so she's just like, oh, Kris, oh, thanks, oh, right? So she's like, but we always tell people, we're like, hey, like Karen is the one who will cut you. She's the nicest human being you've ever met, but she will cut you like there's no tomorrow. Like, she is ruthless. And like, she does it in the nicest way. She's like, oh, well, you know,
But you suck.
it was really, it was pretty good. But we're not gonna pass you. We're gonna bring you back in a couple weeks. I want you to work on this and this. Try and keep your patient alive. Let's do the right things. Right? So she's just like super nice at like trying to tell you. Honestly, she's not very like, dude, that sucked. Right? Like with me, hey, that sucked. Like that was not good. Right? So she goes down this whole thing, and I'm watching both scenarios, and I'm just like, okay. I mean, I'm just chomping at the bit with this dude. I'm just like, but of course, I'm not gonna throw my own dude under the bus, right? I want him to pass. He's a good guy. He will be a good paramedic, right? So she goes and she's giving him feedback and stuff, and she's kind of done it. And they always wait till the end. She gives her feedback, but she never tells them whether or not they pass or fail, right?
During like while they're doing
like while they're giving the feedback, right? And she's like, hey, you need to do this. And I'm like, okay.
You just have one try, or is it, do you get
No, it's one try. Yeah, one try. Right? I mean, you'll come back 2 or 3 weeks later with a bunch of remedial training, and everybody knows that you failed, and your probation is extended, and you're like, oh, you're that guy. Right? So, like, she's done, and I'm like, so, Karen, just a quick question. Just to get this out in the open, I was like, did he pass or did he fail? She's like, oh, no, he passed both of them. I'm like, okay. Okay, hey, congratulations, buddy. Super stoked for you. I go, can I? May I? And so me and the other captain are standing there. I'm like, dude, that sucked. I was like, that was not good at all. I was like, I would not have passed my paramedic students on this scenario. I was like, it's your job to be a leader, and you were not a leader at all. Like, you had all kinds of stuff going sideways, and you didn't control it, and didn't take control of it. And he's just like, well, that opened the door for the other captain too. He's like, yeah, man, that was like rough. And so like, and then Karen just sitting there like, okay, well, it was really good, you know, like trying to reinforce, like, hey, good job, hey, right? And so, yeah, it's just like, I'm like, so it's that kind of thing where it's like, you have to be good and know your assessment skills and then finish those assessment skills. And he was all disorganized, right? Disorganized all over the place. Other people were running his call halfway through it and stuff like that. He got wrapped up with a screaming patient, had that whole thing of, oh, I don't know what to do when the patient starts screaming at you, right? So, yeah, so that's why we do kind of what we do here is to, like, my expectations are here, because I don't want you to come in here. And I keep telling him, it's like, the reason you suck is because you went to like horrible community, dude. And he's just like, because like I'll just ask him random questions like that. I'll be like, hey, we're gonna go over park and burn formula tomorrow. He's like, what the heck's park and burn formula? I'm like, hey, we're gonna do dopamine drip. He's like, what? He's like, oh yeah. And that's the funniest thing, because this dude sucks at math, right? So we have like Snapchat photos and videos of this dude trying to do math. We're like, oh, blah, 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 doing math again at the firehouse. And we're like hundreds of drops off of our dosing. And like the RSI stuff, way off on stuff. He's just like, son of a. So you guys, I hold to an even higher standard, and you guys aren't even my probies yet. So I'm excited if you guys ever become one of my probies, because you guys think it's bad, it gets way worse. Okay, so we're moving on to seizures. Yeah, so we threw a couple of those stroke things out there because you guys knew that we were doing seizures this morning. So we just had to just kind of throw that curveball.